So, Dr. Shapiro, how do we manage irritable bowel syndrome? If patients are having a lot of IBS symptoms, is it possible for them to have a normal life?
Right. Well, thank you, Dr. Eshron. I think it's a great and a common question that patients often ask. There's a lot of different modalities of treating IBS. And so I'll give an overview. We'll go through those in more detail. But I think the goal is really to allow patients to get back in the driver's seat of their own life. For many patients, they've rearranged and reorganized their entire life around their symptoms, needing to know where bathrooms are, avoiding intimacy, avoiding outings with family and friends. And so we really want to try to start to take back their lives for them or help them take back their lives. The overview of treatment, and we'll get into the details with these. So there are lifestyle related things. There's some evidence for exercise can be helpful. There's some emerging research that's happening with the benefits of good night of sleep. But the core of treatment that we use and employ in clinic are diet therapies, and we'll go through what diet for IBS looks like, medications, both prescription and over-the-counter ones, behavioral therapies that work on the gut-brain axis, which are really exciting pathway of treatment. That we have some new options that are digital now in the more modern era. Surgery is not a treatment that is required for IBS. So I think it's important for patients to know that that is not something that they're potentially facing down the road for their irritable bowel syndrome specifically. And then probably the most important thing to know is that everyone's IBS is different. We know patients who post-infectious irritable bowel syndrome, or there was a clear infection that triggered it, do have a slightly better chance of their symptoms going completely away. Many patients have symptoms come and go, and they may be able to identify with the help of their healthcare provider triggers in the diet, triggers that might include stress in their life, so that they know what things predispose them to having worse symptoms and can have better control over that. And because everyone's IBS is the same, I think it's important to work with your healthcare provider coming in with what treatment preferences you might have, to talk to them about whether those are reasonable treatment options for you, and then to understand the broader landscape of treatments to try to align what might help you with your symptoms the best. So for some patients, IBS is a lifetime condition. For many it is, but the amount of impact that has on their life can substantially decrease with the help of a good treatment plan.